So initially, I think when patients kind of present to the practice, they may have some questions as to whether surgery is even appropriate for them. So the first step really, once you've kind of become aware of the practice, is to have that consultation, right? And so the purpose of the consultation is not to say, oh, you're absolutely going to need surgery or this is what you have to do. It's really information gathering. So it's, these are my issues as a patient. This is what I'm concerned with as a patient. And are we the appropriate facility to address and remedy those concerns that you have as a patient? Is that medical, right? So is it therapeutics that we could recommend that you might want to consider for management of your issue? Is it surgery? Possibly, we're a surgical practice. But really, it's where the patient comes and they say, these are what I'm worried about. Can you help me? And then as a facility, we say, well, this is what we do. These are the options for you. And then you as the patient then decide the best course for yourself based on that information. Right. So part of the evaluation or the consultation is kind of coming up with a differential of what likely is the reason why the woman is experiencing the symptoms that's driving her to come in and seek care. So our plan of attack, so to speak, our strategy is based on those symptoms. So a patient that comes, perhaps she thinks she has fibroids. This is pretty common. Patients will come in and they may be having heavy periods, they're having painful periods, and they might have family members or friends who have fibroids. And so they say, oh, you know, I've got these symptoms. They may have Googled, and Google will say, worst case scenario, you have cancer. It's usually not cancer. But then they may have come up with the diagnosis like, oh, I'm pretty sure I have fibroids. And that may be true, but there's also a condition called adenomyosis where you have endometrial tissue in the muscle of the uterus. And those symptoms can very oftentimes mimic fibroids. So there's imaging that we can do to kind of discern what it is. But ultimately, not until we've gotten the pathology back from the surgery do we actually get an official diagnosis, a formal diagnosis of fibroids or adeno, and the conditions are not mutually exclusive. You can have both. And sometimes that's a surprise for the patients because they thought, oh, I only have this one issue, and it's, no, you have fibroids and you have adeno. And so then it's, how do we manage that going forward? So